going to get started. Welcome everyone to the Mental Health Action Partnership Learning Session with a mental health policy update from Washington, D.C. There's a lot happening in D.C. right now. So for those of you who are new to MHAP, the MHAP is a statewide mental health coalition concerned with ongoing mental health system improvement throughout Wisconsin, throughout the lifespan and across the continuum of care. We are very pleased to welcome our presenter, Hannah Wesolowski, who is the Chief Advocacy Officer for NAMI, the National Alliance on Mental Illness. She works at our national office in Arlington, Virginia. She's going to talk about recent changes in mental health policy at the federal level and how they might impact us here in Wisconsin. So we're going to hear from Hannah. We'll take a few clarifying questions as to, in case there's anything, a point that you just didn't quite get. And then we'll go into breakout groups to discuss what we've learned and the impact on ourselves personally in our treatment and in our work. And then also what advocacy actions we have taken or plan to take. And then we'll come back and share with the whole group and do further Q&A. So now it's my pleasure to introduce my colleague. I was actually on the NAMI policy team in Arlington when Hannah came on staff. She has just been going up ever since. She leads the National Government Relations Policy and Advocacy Team, which develops policy positions and advocates NAMI's federal priorities and supports the policy work of our alliance at the state and local level. Hannah serves as a member of NAMI's executive team, and she's a frequent spokesperson to the media. You might have heard her on the Hill or, that kind of thing. And she serves on the executive committee of the Friends of the National Institutes of Mental Health and on the boards of the Public Affairs Council and the American Brain Coalition. So with that, I will turn it over to Hannah, who has some slides and going to give us the news. Hannah, go for it.
Thank you so much, Sita. Such a pleasure to be with you all. And yes, there is a lot to cover. I want to make sure you can see my slides okay. Somebody could give me a thumbs up. Awesome. Thank you so much. So yes, it's been an interesting time, and we'll try to cover as much ground as we can in the next 25 minutes or so, and then have a little bit of time for questions. So I'll talk a bit about budget reconciliation and where we are right now, and what that's going to mean for Medicaid potentially, what Medicaid means for mental health. There's a lot of important data out there around the Medicaid program and its impact on mental health and substance use services. So we'll talk a bit about that so you have all of the data at your fingertips. And then what else is going on in the federal space that you should know about that's going to impact what resources and care you might see in Wisconsin. So without further ado, I'll jump in. So budget reconciliation is a very fun and complex process. Bottom line, the thing you need to know is that this is an expedited way to get legislation related to revenue generation or taxes through Congress. And it's an expedited process because it allows the Senate to bypass the filibuster. The filibuster would require 60 votes to get legislation through. This only requires a simple majority. And as you might know, the Senate has Republicans have a 53 seats to the Democrats' 47 seats. So it's a very tight margin in the Senate. And so this would allow a bill to potentially go through. So this is the process Congress is using to pass a pretty extensive tax extension and spending cut package that is a cornerstone of President Trump's legislative agenda. This has been used in recent years for the Inflation Reduction Act, the American Rescue Plan Act, and they attempted to use it in Congress in 2017 to repeal and replace the Affordable Care Act. Fortunately, that was not successful at the time. The Affordable Care Act does a lot of great things for mental health care, and something that we fought pretty hard to make sure the Affordable Care Act didn't go through. The process is a two-step process. So the first step was to have a budget resolution. And basically, this resolution has to go through the Senate and the House, and they have to agree somewhat on target numbers. How much do they want to cut? The key here is that when the House passed their budget resolution, they directed the House Energy and Commerce Committee. That's the committee that oversees Medicaid, Medicare, major health programs, to cut $880 billion. Now, we'll often hear, I've looked at the budget resolution, it doesn't say Medicaid anywhere in there. And that is correct. It does not say Medicaid. It says cut $880 billion from Energy and Commerce. But there has been independent analysis by the Congressional Budget Office that there's no way to achieve that level of cuts unless you're significantly cutting Medicare or Medicaid. And the entire party has said Medicare is not on the table, so this is not a Medicare cut. So that leaves Medicaid to get to those cuts. You could cut every other program that Energy and Commerce oversees, drop it down to zero, and you would come nowhere close to that $880 billion. So you have to touch Medicaid if you want to get to that level of cuts. So that's kind of the cornerstone to all of our worry about Medicaid and what that's going to mean. Now, once those resolutions are passed, you go to step two, and that's where we are right now. And that's creating a budget bill, figuring out what exactly are we going to cut? What are we going to extend? What are we going to add? What are all the spending measures that we want to put in this bill? So those resolutions had instructions to different committees of how much to reach. The Committee on Agriculture, for example, has to reach $230 billion in cuts. They oversee the SNAP program, which is another program we're worried about, nutritional assistance programs. Each committee has the cuts that they need to go after to reach the overall number that Congress wants to try to save money on. Oops, wrong way. So this is where it gets a little bit interesting in trying to figure out how are the Senate and the House meshing this together. The Senate's bill said that they had to cut at least 4 billion with a B, but with a target of cutting 1.5 to 2 trillion. So the Senate kind of didn't do its job. It kind of left a big open space because it didn't want to take that hard vote early on of saying we have to cut this much in this jurisdiction. But the House bill said that you have to cut at least 1.5 trillion. So they went for those hard numbers. And that's where you get the 880 billion from energy and commerce. So ultimately, the question is, which side is going to win out in this battle? How do you bridge this divide? And there are a lot of divides in Congress right now around this resolution. You have the typical Democrat versus Republican divide, and I would say that's not the major one right now that we're looking at. What we're seeing is the House versus the Senate. You have those major differences in the bills that they passed around the resolution, and so now as they get to work, figuring out what that means. It's really the House committees right now that are looking at specific cuts, and the Senate is waiting to see what decisions the House makes and wants to work behind closed doors with House members on finalizing those cuts, but they're really leaving it to the House to kind of have to make those hard decisions right now. A lot of members in the House are saying, hey, we want to know we have the Senate support. We don't want to take this hard vote on all of these spending cuts if it's not going to pass the Senate. That's politically very risky for House members, especially House members who may be in districts that'll be tight races in 2026. Then you also have the tension between fiscal hawks and moderates. So the fiscal hawks who really want to cut federal spending, they want to reduce the federal deficit. And so they want to see these cuts be much, much higher, more significant. And then you have moderates who are very concerned about the impact of Medicaid and their cuts in their district, who are really unsure that they want to go that far. And so you have those two parts of the Republican Party that Speaker Johnson in the House is trying to please. And then finally, you have Congress versus the executive branch. The president continues to say different things that are confusing the process. You know, for example, last week he said, well, we're not going to touch Medicaid. But to get to these these tax cuts and tax extensions, you have to cut Medicaid to pay for it. So these are just a few of the headlines from this week that show that tension and what Speaker Johnson in particular in the House is trying to balance, all those plates up in the air of those various tensions. Key point here, the House has an even tighter margin than the Senate. The Republicans can only afford to lose 3 votes if everyone is voting. It is the smallest margin between the parties since the 1930s. So there's not a lot of wiggle room there. And the Republican Party beliefs are very, very disparate between those fiscal hawks and those moderates. So those are all the things that are at play. The longer this goes on, the harder it becomes because there's more and more data coming out from advocacy organizations about the impact of potential Medicaid cuts. So what's the timing? When do they want to do this? Well, originally it was Easter. That obviously did not happen. They wanted to have all of their spending decisions made by Easter. Then they said we're going to do it by Memorial Day. Well, Memorial Day is going to be here before we know it, and that's clearly they're not going to have consensus by Memorial Day. So now they're saying potentially July 4th is what they're looking at, and hoping to be able to make decisions by that point in time, and hopefully have a bill on the president's desk. So, Energy and Commerce, again, that's the committee that oversees programs like Medicaid and that spending, which is a huge portfolio. It was supposed to mark up legislation earlier this week. May 7th was the original date. They did not have consensus among the committee on what those Medicaid changes would look like. Again, you have those tensions between the fiscal hawks and the moderates, those who want to cut Medicaid more significantly and those who do not. And so they bumped it back a week. It's set for next Tuesday at 2 p.m. That means that they have to have the language out 36 hours ahead of time, which is, if you're doing the math, 2 a.m. on Monday morning. So we're going to have a very busy Monday morning looking at the bill to see what they actually include. And that's important because there are so many different ways you can look at transforming the Medicaid program. And a lot of our advocacy so far has been just trying to point out that any of these cuts are bad because we don't know what they will ultimately land on. And that continues to change pretty much hour by hour, looking at the different Medicaid proposals. The bottom line, all of the proposals to cut Medicaid are bad for mental health. They all would hurt people with mental illness and substance use conditions. And we'll dig into a little bit of why that is now. But that's kind of the overarching statement here, is that none of these are good. You'll hear a lot of talk around fraud, waste, and abuse. There's not $880 billion in fraud, waste, and abuse in the Medicaid program. In fact, there's been a lot of independent analysis that, that Medicaid is actually one of the more efficient health insurance programs, and over 90%, 94%, I believe, of spending gets to its intended target. So, I think everyone supports getting rid of fraud, waste, and abuse, but that's a very minuscule part of the Medicaid program. And frankly, a lot of these initiatives that are supposedly for fraud, waste, and abuse are going to hurt the people who are on Medicaid. There've been, like I said, lots of different proposals out there. There was a 50-page document put out from Energy and Commerce that looked at many different proposals. So there's lots of ways that they can go after different aspects of Medicaid to try to save money. The big one that seems like it's likely going to be in, no matter what the package looks like, is work reporting requirements. So this would require people to prove that they are working or looking for work to maintain their Medicaid eligibility. The thing about work requirements is there's a lot of evidence that it doesn't work. It obviously, a lot of people who cannot comply with the complicated paperwork or online software to report things will lose their coverage, even though they're still eligible. Exemptions are really, really hard to administer. So even if people might be technically qualify for an exemption in the program, it's really hard to get that exemption. There's also a lot of people who think about somebody with a first episode of psychosis as an example. They may not have a disability determination, and we don't want them to have a long-term disability determination. We want them to stay connected with healthcare get early intervention, get their care, and be able to continue with work and school. Um, Also, work requirements typically don't help people look for jobs or stay employed, and they are really, really costly for states to implement. We're talking tens of millions of dollars. Um, your DHS put out impact report on kind of what it would mean for the state of Wisconsin. It would cost $6 million for work reporting requirements for the state to administer that program annually. If the state were to provide employment and training services, that's another $60 million. And over 50,000 people in Wisconsin alone would be at risk of losing coverage because of these work requirements. So the case against them is pretty overwhelming. I think there's also this narrative that people who are on Medicaid don't work. And actually, that could not be further from the truth. This is from Kaiser Family Foundation. Most people on Medicaid who can work do work. So you see here that 64% of people on Medicaid are either working part or full time. Another 29% or so are caregivers. They are in school or they're not able to work due to illness or disability. So you're really talking about a small percent of the Medicaid population here, but all of these individuals would have to go through some process to either become exempt or to prove that they work or are trying to work. And so that means a lot of people will lose coverage. We've seen work requirements implemented in Arkansas, for example, in 2018. In just 7 months, I think 18,000 people lost their coverage. And they didn't lead to long-term employment for anyone. What we know leads to long-term employment is supported employment programs. There are employment investments and programs that we could invest in if work is really our target and what we want for people. Uh, at NAMI, we've collected I think over 1,400 stories this year, people's what Medicaid has meant to them. And over and over and over again, what we hear is being on Medicaid helps people work. So cutting people from their coverage is not going to lead to long-term employment. In fact, it's probably going to make it harder for people to work because they're not getting their needed care. This story is similar to so many stories that we hear over and over again. I'm not going to speak to Medicaid expansion because it doesn't impact Wisconsin, but that is a large part of the conversation, and potential savings for the other, from the other 40 states in DC that do have Medicaid expansion. It's becoming less and less a part of the conversation. Speaker Johnson the other day said that they were not thinking about changing the matching rate for Medicaid expansion. So we'll see what happens. Again, it doesn't necessarily impact Wisconsin, but it is part of the larger conversation. There are lots of other things that are potentially on the table. So, making sure people who receive Medicaid are eligible, which sounds good, but is actually just more frequent eligibility redeterminations. So every quarter, every 6 months, people have to jump through those hoops, and the people who aren't able to jump through the hoops to prove that they're still eligible lose their coverage. Lowering the federal matching rate floor. So the federal government pays a minimum of 50% federal matching for every Medicaid program, and it goes up to, I believe, 83%. That would mostly hit blue states if they changed that formula and lowered that floor, but that's another way to save money. Um, uh, in the DHS impact report for Wisconsin, anything that kind of deals with the administration of the program would likely have a $93 million a year impact on the state of Wisconsin. So that's quite significant. The other big thing is per capita caps or block grants. So saying you have this many people on your Medicaid program, this is how much we, the federal government, are going to give you for that. So that's not based on real costs. It's based on just an estimate per person on Medicaid. What happens if another pandemic hits and costs go up? What happens if there are just many other unexpected costs that the state can't control? Then the state has to make up that difference, and that is incredibly costly. Again, DHS in Wisconsin estimated that that would cost anywhere from 6.4 to 16.8 billion dollars for the state over the next 10 years. Another thing that's getting a lot of talk is mending the use of provider taxes. So states to pay their portion of Medicaid, every state but Alaska has some form of provider tax where they tax providers, and that money is used to pay part of the share of Medicaid for the state. And so there's potentially amending states' ability to do that and generate that revenue to pay for their Medicaid program. So as you can see, there are a lot of different ways that we can go after Medicaid here. And at various points in time, some of these have been more popular than others, and hard to know where there's consensus among Energy and Commerce and House Republicans right now. I will note that the Congressional Budget Office earlier this week, it's a nonpartisan entity, put out a new analysis of what all of these programs, all these different changes, what it would mean for people. And the bottom line, and it's tiny here, I understand that, but the very bottom, increase in uninsured people. Every single one of these proposals increases the number of uninsured individuals. So, I think that's the bottom line here. Medicaid is too important for mental health care to allow for these cuts and for people to lose their health insurance coverage. And this is why it's so important in our space in particular. So, Medicaid is the single largest payer of mental health services in our country, pays for $1 in $4 spent on mental health and substance use care. About 40% of non-elderly adults on Medicaid have a mental health or substance use condition. 1 in 3 people with mental illness in this country rely on Medicaid. So it covers a huge portion of people with mental health conditions. And something that surprises a lot of people, 1 in 10 veterans rely on Medicaid for their healthcare coverage. Everyone assumes veterans are covered under the VA, and not all veterans are. And 1 in 10 veterans rely on Medicaid to get their health insurance coverage. And Medicaid covers, different states may choose different benefits, but it covers a wide range of inpatient and outpatient mental health services, psychiatric treatment, counseling, medications, and it also allows states to innovate and try new initiatives through waiver programs that really have improved mental health services in many states across the country. Now, in Wisconsin in particular, Badger Care, I pulled some of these from slides that Julia did, so thank you, Julia. But there's some pretty compelling data of the impact of the Medicaid program in Wisconsin, covering 1.2 million people, 1 in 3 children, 1 in 6 Medicare beneficiaries, 1 in 3 people with disabilities, 1 in 7 adults. I mean, this is huge. And imagine any significant changes, what it would mean for the overall population of the state. I think a really compelling data point, too, is that would have a huge business impact. Medicaid supported over 30,000 healthcare businesses in the state, and that's $11 billion in 2023. Again, significant contributor. People often don't realize how much Medicaid pays for kind of healthcare administration. So how much they pay for, how much Medicaid is used to pay for the administration of DHS, for example. That's significant across the country. And so, Medicaid really provides kind of the backbone of the mental health and substance use system. And that funding is absolutely critical to help people. Uh, so what happens if any of these cuts come to fruition? That's the big question. States, Wisconsin, other states have to balance the budget. And so if you're getting less money from the federal government, or the federal government has extra hoops to jump through, the state is put in a really tough position and has to make some decisions. So will they change eligibility? So fewer people are covered by Medicaid to make up the gap? Will they cover fewer services so care is less comprehensive so that they don't have to pay as much? Will they pay providers less? They already pay providers not enough. So fewer will accept Medicaid. And will they think about cutting other programs to help fill that gap? All of these are real possibilities that Wisconsin and other states are going to have to grapple with if these Medicaid cuts come through. It puts states in a really, really tough position. I think it's really important to know that 65% of the state's total Medicaid spending in 2023 came from the federal government. So that's $8 billion. So think about how, if even if a few percentage points are trimmed off of that, what that would mean for the state and the gap that they would have to fill. And it's unpopular to cut Medicaid. NAMI's done a lot of polling around this, and Americans, both sides of the aisle, do not want to see Medicaid cut. They know Medicaid is critical to the mental health system, and they know that Medicaid is critical for people having the healthcare coverage that they need. So that's Medicaid, but that's in the context of so many other things that are happening at the federal level. So my last few slides here, there has been the new administration has really sought to restructure the federal government in a substantial way and reduce the size of federal agencies. And there have been several efforts that I think really impact things on the ground in Wisconsin and in other states. So one that I'm sure all of you are aware of, but in late March, state agencies received a letter noting that certain funding, so there was a lot of CDC funding, but particularly in our space, COVID era SAMHSA funding that states had until the end of this federal fiscal year, September 30th, to spend was cut off effective immediately. And that basically pulled back about $1 billion in mental health and substance use funding from states effective immediately, 6 months before states planned on that money ending. We all know that the mental health impact of COVID had a long tail, and that these resources were being used to fill really critical gaps in states' mental health systems. There's currently a lawsuit pending around that. Wisconsin is part of that lawsuit. There is a temporary restraining order in place that was upheld in mid-April, and there's another hearing expected sometime this month. And so remains to be seen how that will play out. Technically, states can spend that money while that restraining order is in place, but states are really worried should this lawsuit not be successful, will they then be on the hook for any money that they may have spent? So it puts states in a very difficult position while this lawsuit plays out of trying to determine, do we spend the money? Do we not spend the money? And that's making it hard for states to move forward. So that's one thing. Um, Health and Human Services at the federal level, there's been a major reduction in force and restructuring effort. So this year, 20%, about 20,000 HHS staff have either left, that's a smaller portion, or been let go. And this includes about almost half of SAMHSA staff, the Substance Abuse and Mental Health Services Administration. So, for example, the entire data and statistics team at SAMHSA was cut. It's a 17-person team. They did the national survey on drug use and health every year. That's the survey where we get the specific 1 in 5 people live with a mental health condition. Some of those stats that look at prevalence of substance use conditions and mental health conditions, as well as how many people are getting treatment every year. That entire team was cut at SAMHSA. There was a lawsuit filed just earlier this week by 20 state attorneys general, again, including Wisconsin, to require HHS essentially to reverse those decisions. So we will see how that plays out. There has not yet been kind of any determination in that case, something we're obviously watching really closely. Something that's pretty new over the last week or so, the Department of Education has also rescinded $1 billion in school mental health resources. So there was a major bill in 2022, the Bipartisan Safer Communities Act, which was probably the largest single investment in youth mental health in our nation's history. And this $1 billion was used largely to fund more mental health professionals in schools. So $1 billion has been pulled back in that as well. So we expect lawsuits will be filed imminently around that as well. But again, this is just pulling back a lot of resources that states rely on. And so now that states are also dealing with Medicaid and potential cuts there, it's leaving states very concerned about what the future means. My last slide here is on the federal budget. So what are we looking at moving forward? Last Friday, the administration put out what's called a skinny budget. So it's very high level. It does not have programmatic details. And, you know, this is just the president's recommendation to Congress on spending. Congress ultimately decides federal spending. So every year, the administration puts out a budget. It's usually more detailed than this. We're expecting a more detailed version in the coming weeks. But high level, it doesn't look great. It would cut National Institutes of Health funding by close to 40%. It would cut existing SAMHSA funding by about 15%. And it also finalizes a move that was part of the HHS restructuring that would move SAMHSA from kind of its own independent sub-agency into a new Administration for a Healthy America, or AHA, AHA. That would kind of mean SAMHSA doesn't operate as a kind of independent entity, which certainly has elevated conversations around substance use and mental health by having that sub-agency level for SAMHSA. We don't know a lot of what that means, but it is very concerning and something that NAMI personally has we have spoken out against, given the question marks that we have about what this means for the programs we care about. But a few weeks ago, there was a more detailed document that was leaked to the press. It was a pre-decisional document, so it was by no means final. It was called, it's a pass back. Basically, it's what the administration sends to agencies saying, this is what we propose to cut, and then agencies can kind of come back with their counter recommendations. But in that document, there were a lot of concerning things. They proposed to eliminate funding for a lot of different mental health and substance use programs. Some of those ACT team funding, consumer and family statewide network grants, grants for the CCBHC, Certified Community Behavioral Health Clinic program, as well as eliminating 988 specialized services for LGBTQ plus youth and young adults. Again, none of this is final, and that was a very early draft, but certainly leaves those of us in the mental health and substance use community very concerned and on high alert, advocating with Congress to make sure those programs are protected. So I know I'm not the bearer of great news, but we do have a great Medicaid resource center that has the state fact sheets, it has policy positions, it has polling, it has stories of people impacted by Medicaid, and you know, encourage you to go there and also reach out to me if you have any questions.
Thank you, Hannah. I feel my hair being singed here with all of this news.
Not the like bearer of great news anywhere I go these days. So I
Yeah,
apologize for that.
yeah. So before we go into breakout groups to kind of chew on this information amongst ourselves, and then we'll come back for more Q&A at the end of the session. But before we do that, does anyone have clarifying questions about anything that Hannah said? Something that you need to kind of know in order to be able to take this into discussion? Going once, going twice. Okay, so we're going to send you into breakout groups, and feel free to go, oh, holy cow, this is what this means for the services that I receive. This is what this means for the services that people I care about receive. This is what it means for my work. This is what it means for my agency. This is what it means for my community. And then what kind of action you have taken or are planning to take to protect Medicaid and protect against some of these other proposals. So Julia, please send us into breakout groups. Welcome back, everybody. I think it was people are still coming into the room here. So let's open up for some Q&A. Hannah, I'll start out with one question. With SAMHSA getting folded into the Administration for a Healthy America, what happens to things like the block grants, the mental health and substance use block grants? What happens to the National Survey on Drug Use and Health if the staff from SAMHSA was all gone away?
Yeah, I mean, those are good questions. We don't have a lot of details, but the block grant, in the president's skinny budget and in the like leaked budget proposal, the block grants are still in place. And wouldn't change. They'd be administered by that new administration for a healthy America. Um, as for the National Survey on Drug Use and Health, what we have heard is that they want to centralize all data and analysis functions, and so the thinking is a survey like that would be in a centralized HHS department. But we don't know yet. We know that data had already been collected for the 2024 report. So obviously this is going to significantly delay that if it does come out. But that's what we're hearing is that there would be a centralized function for all of the agencies.
Okay, thank you. Who else has questions? Raise your Zoom hand if you would, because that'll put you up to the top of the screen. Go ahead, Pete.
My question for Hannah, if right now you're saying that for Wisconsin it could be as much as $93 million, was that correct? If I read that right?
So if there are changes in how states are allowed, like how federal matching rates can be used for administrative purposes, the state's DHS estimates that it could cost the state up to $93 million a year to fill that gap.
Okay. I mean, if we're going to be proactive and, start talking to the people to prepare them and so that we can help be prepared too, do you have recommendations of certain, I guess, whether it's at DHS or whoever, the groups that are going to lose the money, how can we help them? I mean, how best besides just, sending a letter and saying, okay, we might lose 93 million. I don't know who's going to lose it or what. The hard part is being in this limbo.
Yeah, I wouldn't give up yet. I think that none of this is a done deal. And I think there are so many ways it can play out and how it could impact different programs or support for organizations. So I think the energy is best spent right now pushing on not just your members of Congress, but on state leaders, state legislators, making sure they're aware of the gap that they would have to fill if the federal government makes these changes. Um, uh, I think a really powerful voice with Congress right now are state leaders who are the ones who are going to be left holding the bag. So I wouldn't give up at this point. I would use your energy to put a lot of pressure on every policymaker at every level, and make sure that they are fully aware of the implication of these changes. Again, DHS put out a great analysis of potential coverage losses and costs of these different proposals. So you have that state specific information, and we got to make sure everyone knows about it.
Thank you, Hannah. Kristen.
Related to talking to state level, what about Wisconsin's county-based system? Because that really impacts us a lot in a rural area. We have fewer resources, we have fewer providers. We have a county board that prefers to give money to law enforcement over mental health, a lot more criminalization of substances and things like that. And there's fewer places for treatment. So it's all impacted there too. And if there's a way I could pitch this to any of them to get them to understand, it won't be good for them either.
Yeah, Kristen, I think every policymaker at every level, I mean, county folks have to push on state folks, have to push on federal folks, because this is going to have an impact everywhere. And we've actually found a lot of success with law enforcement as allies in this conversation because without proper care or without proper intervention, more and more people's symptoms are going to be untreated. And that means more pressure on law enforcement, more burden on their jails, more situations where they see that people can be better supported with mental health treatment, but they're the ones who are left to respond. So law enforcement have actually been really good allies in a lot of communities, because they know exactly what's going to happen if people lose their health care coverage. But yes, county leaders need to definitely understand this and they need to be raising a ruckus.
And Julia put a report from DHS in the chat. It had some from Wisconsin Department of Health Services. So there's information there that many of you may have seen. So what's your projection on this lawsuit with the COVID relief grants that were suddenly rescinded? Do we have any guesses? Like, what's the timeline on that?
I mean, I have no guess because I have no idea how long, like how many levels of courts will go through and appeals until that's exhausted. So that's the tough thing. Any changes, there's entities that have standing to sue, but court cases take a long time to resolve. And I would be shocked if that's resolved in kind of the short term, because even if there's a decision, there's likely going to be an appeal on the losing side. And so, I couldn't even venture to guess how long that's going to take to play out, unfortunately.
Yeah. Well, and someone in our small group made the point that our state budget is supposed to start July 1st, but if there's so much uncertainty coming from the federal level and none of this is going to happen until July 4th at the earliest, what happens
Yep.
to state budgeting?
Yep. Yeah.
Deeply
Yeah,
off.
it's putting states in an impossible position. The magnitude of changes, the magnitude of potential changes, and the impact of this funding is putting states in a really, really tough position. And which is why state leaders need to be incredibly vocal in this conversation about what they're facing. Because, it's the constituents back home who are going to pay the price, and Congress needs to understand that.
Yeah. So let's talk a little bit about what people are doing. We do have a very strong Medicaid coalition in Wisconsin. It's, I think, up to about a couple hundred organizations that have been meeting every other week virtually and doing stuff around the state. And one of the things that's going to happen in Green Bay next Tuesday, Tuesday the 20th, is a press conference and a community conversation, and it'll be at Foundations Health and Wholeness in Green Bay. It's from 3:30 to 4:30, and the community is invited. So any of you who are within, shouting distance of Green Bay, come on up. And the media will be there. There will be a panel of people, providers and people with lived experience, people who will be impacted by Medicaid cuts, talking about mental health and substance use in particular. And then there will be facilitated conversations around tables. We might end up writing to Congress or calling Congress right from there, because, the Congress needs to hear from us. So anything else that anybody knows that is going on in terms of advocacy to push back on this? And if you don't know about the Medicaid Coalition, Lisa Hasenstap's email is in that chat in the post. Contact her. They're meeting virtually every other Friday at 1:00. Just met.
I have a question real quick. Does
Sure.
anybody know if Project Aware is one of the things that's impacted by the education cuts? Because the mental health navigators in one of the counties we serve, Forest County, they are instrumental. Like they're the people I work with in that county, and I'm so grateful for them because that's been a way for us to connect to a really underserved area. And I believe that part of their funding is from SAMHSA, and I don't know if they go away, there's kind of no mental health in that area. Like they do a lot, and they connect people and providers and
Yeah,
supports across
I
the
see
board.
Kathy Markland coming off mute here. Kathy, can you shed light on?
Yes, I have not heard anything about the Project Aware dollars being impacted by the cuts that have occurred. The school mental health dollars that were reported out that Hannah shared with us really impacted some. Wisconsin had grants that were part of that bucket that impacted some efforts to increase the number of school services staff. So we had about $8 million that had been channeled to continue a program that was expanding, people being developed for school social workers, school counselors, school psychologists. I think UW-Madison had a $6 million of that they were using to developing school psychologists, in fact. So that's the pot of dollars from a school mental health perspective that I understand that was impacted by the most recent cut that Hannah referenced. But I have not heard that Project Aware has been touched at all yet. And I'm super glad to hear, Kristen, that that's so helpful, that what's going on up in Forest County with that investment in the mental health navigators is making a difference. That's great news.
Yeah, and I'll just say that my understanding aligns with Kathy, because Project Aware is through SAMHSA, not the Department of Education, which is where those other grants were cut in the last week. And Project Aware was also not listed as a program for elimination or significant cuts in the leaked document I mentioned. Again, that's not a final document, but certainly if it's not in there, that gives me a little bit of relief. We don't have details. The president's budget, again, was super high level, so it's not line item. So we don't have details on what that funding would look like, but that's a ways into the future anyways, and there's still a lot of opportunity for Congress to take a look at options to protect various mental health funding lines. So for now, I think Project Aware is okay. I haven't heard any indication that it isn't, and hopefully it will continue to be okay. And we'll pass information through NAMI Wisconsin to share with all of you if we hear otherwise.
Hopefully Doge doesn't find it. That's all. They don't even know it.
Okay, are there any other questions before we close?
Well, I just wanted to jump in quickly with something that was shared in our group because it was something I've not been attending to. But Marianne shared it from the work that Ola is doing in Wasa, and really connecting it to the work of the health navigators within the marketplace programs and the work that Covering Wisconsin does, and that has been significantly impacted by cuts right now for those healthcare navigators, for people who are helping again people get to coverage. And we know that in Wisconsin we have more people who are accessing through marketplace because we have not expanded Medicaid, and so and the navigators help people get to Medicaid too. So for both of those channels, they're important players and components, and so that's not something I had been tuning into. And so it was really an important learning for me coming out of our group to be paying attention to the people who are at those. And I think amplified a little bit by what Kristen was sharing, different kind of navigation. But again, all of those pieces where we have people who are serving in important roles of connecting people to access and connecting people to coverage and connecting people to a resource. And if we're eroding some of that connective piece, we need to be paying attention there as well.
Yeah, Hannah, I wonder if you could talk a little bit more about the impact on the Affordable Care Act and on the health plans.
Yeah, so that's a bit complicated because there are other factors at play. But yes, healthcare navigation is not something that the administration is is keen to invest in. So there have been some cuts, and we anticipate attempts at future cuts. I'll also know that expiring this year further complicates this. Advanced premium tax credits, which help a lot of people afford health insurance on the marketplace if they don't have enough income, those expire this year. So that is also part of this conversation that is not getting a lot of attention because it's like a future few months problem where there's some immediate problems now, which is unfortunate, but that's something that's really at risk. That was something that was part of the Affordable Care Act and was increased in some bills a few years back. These tax credits make it much more affordable for a lot of people, and those could potentially end. Obviously, we would hate to see that, but I think there's so many complicated factors at play here that put a lot of these programs with that came to existence through the Affordable Care Act at risk.
Thank you. More bad news.
Yeah, I'm like, oh gosh, don't ask me that. That's another bad.
Okay, well,
Just a ray of sunshine.
David, did you have a question or a thought?
Yes, I had a question for Hannah. How are the public health departments being affected, and would they be also rolled into the AHA, the new AHA?
Would what departments be rolled into AHA?
Public health and public health departments.
Well, this would be at the federal level only. So, state health departments would still operate in the way that states see fit. But the goal at the federal level is to reduce the number of sub-agencies within Department of Health and Human Services. So SAMHSA, the Health Resources and Services Administration, which does a lot of workforce tracking and training, a few other agencies. They're trying to put them all together in this new AHA. But again, that only impacts agencies at the federal level and how they're structured. But in doing so, they're trying to cut down a lot of funding that potentially goes through states through those agencies, if that makes sense. I'm not sure if I answered your question.
Yeah, I think so. Thank you.
And something that's really important to note, again, Medicaid's administrative dollars pay for a lot of the administrative and programmatic expense for like DHS. And so changes to Medicaid could really make it harder for DHS to operate because potentially some of those dollars are at risk. So again, talking about that $93 million, that would be administrative expense that the state might have to make up.
Yep, pretty sobering. Well, everybody, please join me in thanking Hannah for being the bearer of a whole lot of worrisome news. But the news is alarming, but the good news is that our advocacy is working. I was making the point in our small group that the target amount started at $880 billion. That was the floor. And now they are beginning to say that we are hoping to find 400 billion. So we've cut 480 billion off of their target. So, and they were going to have this done by Easter, and then they were going to have it done by Memorial Day, and now July 4th. So the more we can slow this down, the more we can chip away at it, the better. So keep on keeping on, everybody. And before we close, I've got one announcement, and that is that the Mental Health Action Partnership is having an in-person summit. That is, y'all come, and that'll be Wednesday, June 18th from 9:30 to 2:30 at Fox Valley Technical College in Appleton. And so at that point, we will MHAP, the whole coalition, will do a little touch base on where we are with our current priorities, our near-term kind of low-hanging fruit priorities that are going through the legislature right now. And then we'll really turn our attention to medium and long-term priorities for how to improve the mental health system over time. And we got some headwinds going here, but we really do have to keep our eyes on the prize because, as they say in all bureaucracies, this too shall pass. And the more we are there shovel ready, ready to take advantage of opportunities, the better off we will be. So I hope that all of you can come to the summit and take part in our learning sessions. If you would like to be signed up on this list, I put Julia's email in the chat as well, or if you would like to participate in some of the work groups. We have Medicaid and Workforce Work Group, Criminal Justice Work Group, Access and Equity Work Group. We have a Data Work Group and a Governance Work Group. So if you would like to take part in any of those, that's where we really do the real work of MHAP. Please just contact Julia. So with that, Hannah, thank you so much. We'll give you back a few minutes to your day. Have a wonderful weekend. It's a beautiful spring here in Wisconsin. Thank you.
Thank you.
Thanks, everyone.
Thank you,
Keep up your
Sita.
advocacy.
Thank you, Julia. Thank you, Sita.